I'm going to talk about key population-led HIV service delivery, which is focusing on transgender people. So I'd like to start with the definition of the key population-led HIV services, or we call in Thailand KPLHS. So KPLHS is actually a defined set of HIV-related health services, which is focusing on specific needs of the key populations. It's also delivered by trained and qualified lay providers who are often the members of the key populations communities. KPLHS services are identified by the community itself and are therefore need-based, demand-driven, and client-centered approach. So now you can see that how does the KPLHS fill the service gap for key populations. The first thing is accessibility. We need to bring the service to the communities, so the KPLHS need to be located in the hotspot where the key community or the people that we are serving are living or are gathering. The working hour or the operating clinic hours need to be more flexible. For example, if you work for sex worker, the operating hours need to be in line with their working lifestyle. For example, the clinic in Thailand, for sex workers, they open in the afternoon and they close at night. And also the service need to be one-stop service so that they can get access to the services that they need, and we can prevent them for loss to follow up as well. In terms of availability, the KPLHS services need to have sufficient staff that dedicated to the KPLHS, and it has to be need-based, client-centered that I talked to you before. For example, if you work for transgender people, hormone for gender affirmation is also essential for transgender individuals. We cannot provide the HIV testing alone, but we have to address to other comprehensive health needs of the key populations that we are serving. STI screening is also important for sex workers, as well as legal assistances is also necessary for sex workers and other transgender, especially where they get sexually and physically harassed by law enforcement officers or by their clients. Harm reduction services is also important as well for people who inject drugs. And in terms of acceptability, staff need to be the member of key populations communities because they are truly understand the lifestyle of their communities. And the service need to be friendly, gender sensitive, as well as free from stigma and discrimination. And the most important part is also that I want to emphasize about the quality. The staff that providing KPLHS need to be trained and qualified in accordance with the national standards. And we need to establish the strong linkages and have the high acceptance from public health sector, because we need the tremendous support in terms of technical capacity and accreditation standard from the public health sector to endorse the KPLHS service in the communities. And this is you can see that how the KP-led health services play different role in the HIV cascade. It was presented by Matt already, but I just want to emphasize that traditionally, we always perceive that key populations also perform outreach activities by distributing condoms and lubricants. But under the KPLHS approach, key population can perform different role in the HIV cascade. Even they can provide testing, they can even dispense PrEP, PEP, and even ART for their clients, which I can show you later. By empowering the community, first thing we need to engage the communities. So in this example, the Thai Red Cross with the USAID supported project, we are engaged the transgender communities by organizing the first national dialogue between the transgender community together with healthcare providers. We invited representatives from transgender communities across the country. They came together and we consulted them. We asked them what kind of health services they really wanted, what kind of health clinic that they wanted to see in their idea. And from that meeting, it was mutually agreed that there should be a transgender clinic set up at the Thai Red Cross Anonymous Clinic. And we were successfully launched the Tangerine Clinic, which was originated from the transgender community consultation, which was organized in the previous slide. And the Tangerine, even the name of the Tangerine also came from the community consultation. So Tangerine has been implementing by utilizing the KPLHS approach. Because the clinic is transgender-led, 90% of the staff are transgender women, and we integrated hormone services for gender affirmation into the sexual health services right now. And now this is by engaging the community, we also co-create the demand from the transgender community by utilizing the transgender-led online outreach strategies. We provide a safe space for transgender community to come together at the Tangerine Clinic and talk with the gender-sensitive healthcare providers through Facebook Live session. So Facebook Live session is an online strategy that Tangerine is utilizing right now and is very successful at the moment. So now this is the performance by utilizing the transgender-led online outreach strategy. By end of May this year, we have around 2,100 transgender clients visiting the clinics. And of those, more than 70% they were reached from Facebook page by our transgender social media influencer. And of those who were reached by Facebook page, 95% of them, they received HIV testing. And of those who received HIV testing, almost 30%, they were HIV first-time tester. And of those who were tested HIV, 7% of them, they were tested positive. Now, this is the overall number that's showing that transgender-led social media influencer can really increasing HIV testing uptake. You can see on your left-hand side, it was in FY17 or in the year of 2017, it was before we introduced the transgender-led social media influencer. The HIV testing uptake was quite low. But right after we introduced the transgender-led social media intervention in late 2015, you can see that the HIV testing uptake has been significantly increased in the next quarter and even in 2019 with the high HIV positive yield. So this is the example of how the Tangerine utilized the transgender social media influencer who are the popular opinion leader among their transgender communities. We call them as the friends of the Tangerine in order to make the Tangerines more accessible to all transgender individuals who are living in Thailand. So we utilize, we work with them from diverse backgrounds. They represent transgender youth, transgender sex worker, even transgender winner from beauty pageants. So they might look similar to you, but they are different people. And right now, moving to the next HIV cascade is about HIV testing. Now, this picture, this is I got from the Service Worker in Group Foundation. It's showing that finger prick blood correction for HIV testing has been performed by trained transgender health worker at the entertainment venue at night. And it was supervised by the medical technologists. So by building up the capacity of the transgender communities, we are proven that the transgender health worker can perform HIV testing for their own communities. And now, if they are trained and their capacity can be built up and strengthened, they are even able to dispense PrEP and PEP to those clients who are exposed to HIV risk behavior. And this is the slide that Matt already presented. I just want to emphasize about that how KP-led health services contributed to the national HIV response in Thailand. So KPLSS really contributed more than half of the HIV of the MSM and transgender women testing for HIV nationwide in 2018 is also similar to the newly diagnosed HIV positive cases as well as the Thai PrEP users. But this is not an easy journey. When we say that KPLHS can be proven feasible, but to become a KP-led providers in Thailand is very challenging. We have to work with many organizations, but with this project, it has been supported under the USAID Community Partnership, Training and certification project, we have to let the civil society organization to nominate their staff who are the members of key populations and experienced in providing counseling for their clients. And now all the KP lay providers need to pass the training modules, which include gender sensitization, basic HIV knowledge, HIV counseling, and ART and PrEP dispensing. After they complete the required module, the trainee must pass at least 30% of the score and complete 90 days practicum. And the certification will be granted right after the test and practicum complete. The first year certificate will be valid only for 1 year, but the next year, for the second year, will be valid for 2 years, which means you have to extend your certification from time to time. And the way that we deliver the training modules, because the training module has to be co-developed and co-trained by the technical expert, which is medical doctors, pharmacists, medical technologists, as well as members of key population who are experienced in HIV services. When they complete the certification will be used as part of the eligibility criteria to receive the domestic funding or from international funding to support the services that provided by the KP at the civil society organization to support the sustainability of the services. And at the beginning of this month, it's showing that the KPLHS model is very successful, and we can prove that we are able to change the policy at the national level. So you can see that the Thai Ministry of Public Health Regulation has been revised and endorsed by the Ministry of Public Health that allow trained KP lay providers to perform HIV counseling, specimen collection for HIV, STI, rapid point of care test, and ART and PrEP dispensing. And that way, we are also work with the National Health Security Office to allow the reimbursement for the services that provided for key populations at the civil society organization, so that they can be paid. They are no longer the volunteer, but they are the trained community health workers. And I just want to end my slide here by emphasizing that if you want to accelerate an end to the AIDS epidemic in your own country, task shifting and task sharing strategy, and by engaging meaningfully key populations in the HIV programming services and intervention is very important, and I would like to express my sincere appreciation to this organization who are providing support. Thank you very much, and that's the end of my talk.